CBS News political correspondent Caitlin Huey-Burns joined us now with more. Hi there, Caitlin. So Kansas has voted to protect abortion rights in that state, but it's also surrounded by other states with bans and restrictions on abortions. You've talked with the 4 clinics in Kansas that were seeing out-of-state patients. What are they expecting now?
Well, Lana, these clinics have already seen a rush of patients coming from neighboring states where the procedure is banned. There are only 4 clinics in the state, as you mentioned. One of them is right behind me here. And they say that Kansas has really been a destination for people from Oklahoma, Texas, right across the border in Missouri that have bans enacted after the fall of Roe v. Wade. So this is something that had kind of national implications, but also regional ones. And we talked to lots of people who, ahead of the vote, were saying that this is something that could affect the Great Plains region, and now they are expecting to see even more patients. We talked to one healthcare worker who said that they were getting calls from people in waiting rooms in other states as the Roe decision was coming down, and those appointments that they had were canceled, and they were seeking ways to get care here in Kansas.
Well, Caitlin, as we mentioned, President Biden signed a second executive order aimed at protecting abortion access. I want to play more of what he had to say.
We're doing everything in our power to safeguard access to health care, including the right to choose that women had under Roe v. Wade, which was ripped away by this extreme court.
So, Caitlin, what does a new executive order actually cover?
Well, one of the big provisions here is helping women who are seeking abortions across state lines to travel to get that care. But a lot of the executive orders that the president has issued related to this have to do with directing the HHS to enact something or to enforce something or to help with something. There's really little that the president can do unilaterally without action from Congress. This is an effort to show that the administration is trying to do everything they can, but they're really just limited in that executive power. And a lot of this is directives to agencies rather than implementing actual policy. And that's why Democrats are hoping that this is an issue that really mobilizes voters in November to increase their numbers in Congress to be able to pass some kind of federal legislation that has been elusive. But that's also an uphill climb. There's not Democrats in the Senate are not consistent and coalescing around a plan here. There have been some plans introduced, some even by Republicans like Lisa Murkowski and Susan Collins, but some Democrats have said that that doesn't go far enough. So the really interesting thing to see here is whether this, in fact, keeps going as an issue and is enough to bring the Democratic base out, but also to attract some independent and maybe some more moderate Republican voters on this issue.
All right, Caitlin, thank you.